are you doing today? Good, good. So, let's just confirm your name and your date of birth for me. Okay. Right, so today I'm going to do a partial removal of your tonsils. Okay. This will help remove those awful tonsil stones that you've been suffering with for a while. Now you've opted for the awake method, which I'll go through in a second. Okay, so you've been having problems, okay, for 18 months with tonsil stones? Yeah, okay. They're nasty things, aren't they? They smell awful. Have you tried to extract them yourself at times? Okay. Makes you gag, doesn't it? Yeah. Okay. Right. Well, you do know that there's no guarantee that they won't return, okay? Because I'll be taking off a few millimetres of the surface of your tonsils, which is where the stones generally fall, okay? So, if, for example, they come back, you may want to consider a full tonsillectomy, okay, to remove the tonsils completely, particularly if you're starting to get infections as well and feel poorly. Yeah. Okay. Right, well, let me just pop some gloves on. So, today's procedure is going to involve me firstly just giving you a little check, temperature, having a look in your throat, okay, and also have a little feel of the lymph nodes around your throat, neck area, okay. And then I'll need to anaesthetise the area, okay? And I'll be doing that with spray at first. Now that's going to feel a little bit strange. I'll spray the back of your throat and it will start to numb the area. And then after that's had a little time to work, I'll then inject some more local anaesthetic into the tonsil area, okay? Okay. If it's not very comfortable for you or your gag reflex is very strong, then we will have to abort the procedure, but hopefully with the numbing it will be okay. But I'll talk you through it as I do it anyway. Okay, alright. First things first, just going to pop this up there, point it at your head, keep nice and still, and just take your temperature. We're all good there. It's the same as what it was when my nurse took it earlier, so that's fine. Okay. Have you had anything to eat and drink? Okay, you had a light breakfast a few hours ago, that's fine. That's fine for this. Okay. There won't be any bleeding with this because the laser will remove and seal as it goes along, okay? And you won't see any tissue either because the tonsil that I remove will effectively be turned into dust and taken away by a filter. Okay, so as it's removing the surface of the tonsil, it's going into little bits of dust and being taken away. So you're not going to see me pulling out pieces of tonsil. Okay, it's not that kind of procedure. Okay. Good. Okay, as long as you're happy with that. Okay, so let me just have a little feel around there. Okay. Nothing feels sore? No? Okay. Okay, a little bit closer, just around the back. Okay. Just check your face isn't swollen. No. Can you just open and close your jaw for me? That's good. Okay. Just get a new tongue depressor. Alrighty. I'm just going to have a little look into your throat. Okay. I know you've had this done many times, especially in the past 18 months or so. Okay, so nice and wide for me. Thank you. I'm just going to have a look in there. Say R for me. Okay. Alright. R again. Okay, that's fine. Thank you. Okay. Okay. I'm very happy to be able to offer this method. Okay, it's quite new, and I know it's being used in other countries, but I studied quite a bit in other countries, and I learnt how to do this procedure as part of my surgeries, and it's had so far 100% success rate. Yeah, there is a chance that they could come back, as I said, but we've got great results, okay, at the moment. So firstly, let's make sure you've got your apron on there. Make sure that's covering you up, okay. At least the nurse did a good job of popping that around you earlier. A bit fiddly, some of these. Okay. Alright, so before I do anything else, I'm going to spray your throat. Now, I'll tell you in advance because I don't want you to start panicking. When your throat starts to go numb, it's a very, very strange sensation. You might feel like you can't breathe. You can breathe, okay? It won't affect your breathing, but your body isn't sure what's going on. It's not used to that sensation of numbness in the throat and feeling like you can't get your breath properly, okay? So it's just a little bit confused. And all you need to do is just concentrate on breathing as normal. Some nice slow breaths, okay? Yeah, I will ask you to take a nice big deep breath in as I spray your throat, okay? And as we do the procedure, I'll be asking you to say "ah" as I go in with the laser. Okay, are you ready? And I'm not going to be clamping your mouth open with anything during this procedure, okay? You'll hold your own mouth open, your jaw, and if you need me to stop at any time, you can just say so. Alright. You'll be surprised how quick the procedure is. Alrighty, so just open wide again. Thank you, that's wonderful. Come in here with the spray now. Alright. Okay. Cold? Yeah. Okay. A bit more. Okay. Can do some short bursts now. Alright. Good. So, nice breaths, okay? Good. How's that starting to feel? Strange? Yeah. It'll certainly feel strange. Okay. Just breathe in me, okay? So, You can breathe perfectly normally, it just feels very strange. Okay, good, so in and out, and in and out. Just while the spray is taking effect, I'll just show you the laser, okay? So it's just this here, and I'll be popping it into your mouth, and it'll start to blitz away at those pesky tonsils with the tonsil stones, okay? So just this part will go into your mouth, nothing bulky, okay? And the unit will just take all the little bits away that would have been vaporised into dust by the laser. Okay? It's incredible, really. It's wonderful what new surgeries we have these days. Okay, so there it is. Okay. Okay, you're not going to choke. Alright, just keep breathing. Okay, right. I'm going to have to now inject a little bit of local anaesthetic into your throat. Okay? You won't feel this because the spray would have taken effect. Alright, okay. So I'm going to come in a little bit closer here. Alright, nice and wide for me. Okay, and in there. Wonderful. Okay. And in this side, just get that in there. Okay. Close your mouth for a second. Keep breathing nicely. Wonderful. And just a little bit more. Okay. In there. There we go. And on this side, just in there. Okay. You'll be super numb now. Yeah, okay. So nice deep breaths in and out. Okay, and in and out. Wonderful. Okay, well, I'm just going to leave you for a couple of minutes while that takes effect, and then we'll get on with the procedure. And hopefully we'll have you feeling better soon. Alright. Okay, you ready? Okay, so let's just check that throat, make sure it's nice and numb. Alright, so I'm just going to give it a little tickle with the syringe there, okay? Can you feel that? No? Can you feel that? Can you feel that? Can you feel that? No? Perfect. That's wonderful. Okay, so what I'm going to ask you to do is nice deep breaths again, okay? But as I first put the laser in, okay, I want you to go ah and say ah, okay, for as long as you can. Okay, you got that? I know it feels very, very strange at the moment. Yeah, and your throat probably feels super dry because you can't feel it properly. But if you don't feel comfortable at any point, obviously just raise your hand. Okay, don't try to speak while I've got the laser there. Okay, fabulous. Right, so open wide. There you go. Okay, so I'm just going to move the laser in and right, here we go. Big R for me. R. Okay. Right, here we go. Can you feel anything? Good. I don't want you to be feeling anything. There we go, so that's moving the other way. You'll hear the suction sound a little bit as it vaporises the tonsil. Okay, and again. Perfect. Okay, let's get rid of the surface of this right tonsil with the stones there. Okay. Fabulous. Okay. That side is done. Wasn't too bad that side. You got bigger stones on this side. Yeah. I'm just giving you a little rest. Alright, okay, you ready? Okay, and open wide. There we go. Just move this over to this side. And big R for me now, okay? Thank you. There we go. Can you feel anything? Good. Okay, let's move that around. Doing great. Doing great. Okay, another big R for me. Thank you. You're doing really well. And R again. Fabulous. Well done. That's wonderful. Keep going. R again. Perfect. Okay. I think that's got it. I will just move that out of the way. Okay. And we'll have a little inspection. Okay. Nice and wide. Alrighty. Okay. That's looking really good. I'm really happy with that. Really happy with that. Okay. How's that feeling for you? Good. I'll just let you sit there for a minute while I just jot a few things down. Okay. The numbness will probably last for another 30 minutes or so. Okay. Don't give you too much local anaesthetic. I know it feels like a lot, but it's not too bad. Alright. Now, as expected, you're going to get a little bit of soreness and tenderness on the back of your throat. Okay. It's not going to be the same sort of pain that you'd experience after a tonsillectomy. Okay. But that would have been performed under general anaesthesia, okay, but you are going to feel a little bit sore. So what I recommend is you just take paracetamol, Okay, just paracetamol. Yeah. You can take ibuprofen too. Yeah, that can help with inflammation. But if you just want some pain relief, if it's not too bad, stick to paracetamol. But you could take ibuprofen. Yeah. I'd wait a couple of hours before having a hot drink. Alright. Now there's no bleeding in the area, okay? And I wouldn't envisage there to be any bleeding, okay? And remember, we have only removed the surface of each tonsil, okay? And those tonsil stones that form. But you'll notice that your breath will smell absolutely fine now, because the stones do smell awful and that smell is projected in your breath. As you know, you'll taste the horrible taste from them, so that will go, okay? But if you do notice anything forming again, you just come straight back, okay? The other thing to look out for is if you notice any change in your temperature, if you start to feel warm, if your throat seems to go extremely red or sore or anything out of the ordinary, okay? I wouldn't envisage that happening, okay? But you have no temperature now, but you know, you may have picked up an infection a couple of days ago which hasn't come out yet, you know, we're not aware of it, but this shouldn't give you any infection, of course, what we've done today. But if you do notice any problems, swelling, bleeding, temperature, or generally feeling unwell, please call us straight away. Yeah. Okay. Well, hopefully you won't have any more problems, but you know where we are if you do have any more questions for us. Okay. You can sit outside for a little while. Yeah. And then you can go off about your day. Yeah. It's fine if you want to rest for the duration, okay? I mean, it's the afternoon now, so, you know, perhaps just chill out for the rest of the day if you want to. Yeah. I wouldn't go crazy and do any major exercise or anything like that, but it is fine for you to carry on. But I would just wait till the numbness wears off, and then you've got your paracetamol to help you, just so you know how you feel when the anaesthetic's worn away. Alright. Okay, well, take great care.